Yeah.
Go even if you want to.
You're gonna hit
It's my fault.
30.
I was planning on going, like, I was supposed to go to Africa, and my wife didn't want to go to Africa and get stuck.
All right, as soon as we get Joe to sit down, I'll start this meeting. No pressure, Joe.
I'll walk around a few more times.
All right, I'd like to call to order this meeting of the Ottawa County Board of Commissioners. The date is Tuesday, April 27th. Our invocation today is by Commissioner Fenske, followed by the Pledge of Allegiance led by Justin Roebuck. Please rise.
Will you pray with me? Dear Heavenly Father, we thank you for this day and those that are present here today. We thank you for our families, neighbors, and this community in which we serve. We are living beings on a human path and need your wisdom and guidance, Lord. We pray that we all can build the path toward justice and peace. Lord, we pray to you to free us from criticism, blame, and harsh judgment. Show us, Lord, to be creative with our ideas, generous with our time, and fill us with gratefulness, appreciation, and acknowledgement of others. We pray to you, Lord, to help us receive love at the highest levels of possibility. Give us the strength, Lord, to make the universe a friendly place. Life is full of tough decisions, and God's love is the light that shines in each one of us. May that light watch over our service personnel, police, fire, first responders, and our hardworking caregivers. We are made in the image of God with a human heart. We pray to you, Lord, that we may pass on that love that is given to us by you. May our work serve your goodness, and in your name, amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I just have to pause a minute to consider that prayer that we just heard and the ramifications it has on each one of us. And so, Mr. Fenske, thank you for that. So the roll call. Justin, would you call the roll, please?
Yes, sir. Mr. Garcia.
Here.
Mr. Baumann.
Here.
Mr. Zylstra.
Here.
Mr. Zylstra.
Here.
You see him.
All right, we're just having some audio, but we do
Okay.
cease.
Okay. I am here.
Doug? Okay,
Mr.
good.
Dannenberg.
Okay, good.
Present.
And Mr. Meppelink.
Here.
Mr. Terpstra.
Here.
Mr. Holtvloer.
Present.
Mr. DeYoung.
Here.
Mr. Kyers. Mr. Bergman.
Here.
And Mr. Fenske.
Here.
Mr. Chair, we have a quorum.
I
Thank
think
you.
Commissioner Holtzler is on.
Hold on.
You did see that,
Oh,
right?
there he is.
I'm here.
We're having
I couldn't get connected.
audio in the,
There
we
you
weren't earlier though.
Can you hear us?
I can.
Yes. Yeah, but we can't hear him.
Okay, hold on.
So I wonder if we're going to be able to hear Peter pretty soon.
That's me.
Well, we're gonna find out.
That would not be,
Oh dear.
See, when my volume is on, I can hear Commissioner Holtvloer. So it's something to do with,
Wow.
This is Peter. Can you hear me?
gentlemen, can we try again? Either Commissioner Zylstra or Holtvloer?
Can you hear me?
I can hear.
Justin? No.
No?
I can hear you. I can hear you too.
Jim, you can hear me, right?
I can hear you, Doug, yes.
But Justin, you cannot hear me.
okay, while you guys work on that, or see if we can get some somebody to work on that, we can move forward with our presentation of petitions and communications, right?
Sounds good to me,
All
sir.
right. So I think first of all, medical director update, Dr. Paul Heidel. If you come to the podium, Doctor, I want to read something first and foremost, and then I'll let you tell us your story, okay? I have a presentation that I'm going to make. And I'm going to speak into this microphone here so that everyone can hear, hopefully. Whereas the Ottawa County Board of Commissioners recognize the extraordinary career of Dr. Paul Heidel upon his retirement as the medical director of the Ottawa County Public Health Department. And whereas Dr. Heidel diplomatically obtained his bachelor's degree from Michigan State University, maybe you're going to have to tell us about that, huh? And then his medical degree from the University of Michigan. Whereas Dr. Heidel served his country for a combined 20 years in the United States Air Force and Air Force Reserve, including assignments to the 51st Special Operations Squadron in Southeast Asia as a flight surgeon and clinical specialist and chief training officer for Special Operations medical personnel serving in Korea, Thailand, Malaysia, and Philippines. And whereas prior to his employment with Ottawa County, Dr. Heidel served in the hometown of Traverse City for 20 years as a board-certified family physician specializing in obstetrics and pediatrics. And whereas as medical director of Ottawa County for 20 years, Dr. Heidel guided all clinical services provided by the health department, as well as functioned as the department's principal medical liaison to the entire community. And whereas throughout his service to Ottawa County, Dr. Heidel distinguished himself for his medical competence and knowledge, compassion for clients, and consideration for the work of his co-workers. And whereas Dr. Heidel exemplary service was never more on display than during the COVID-19 pandemic, as he led with patience, wisdom, fortitude, and good humor when all were desperately needed. Now therefore be it resolved that the Ottawa County Board of Commissioners, on behalf of Ottawa County and its citizens, thanks Dr. Paul Heidel for his distinguished service to his country, community, and to Ottawa County. Congratulates him on his imminent retirement and wishes him and his family good health and happiness in his well-earned retirement years. Congratulations. Tell his story. So here we go. I'm going to go sit down so I can relax while you tell your story. Okay?
Well, first of all, I don't know what to say. I'm really humbled by that. I'm overwhelmed, really, and I thank you very much for that. Yeah, I think I just lost everything I was going to say to you here. Well, again, thank you very much for that. And I was just going to come here today just for a couple minutes to say thank you to all of you and to the people of Ottawa County for allowing me to be your medical director for the last 19 and a half years. As you know, I'm going to be retiring in a couple of weeks from now, but I just wanted you all to know how much I have appreciated the opportunity to work with you during these last 19 and a half years. And especially how appreciative I am of all the support that you've given to me personally and also to the health department. These are tough times right now, and we realize that. And at the health department, we've had to make some tough decisions, but those decisions have been easier to make knowing that we've had your support and your backing. And I will always be grateful to you for that. I also would like to take just a minute to thank a few other people if I could. Would like to first of all thank the people I work with at the health department. These are sort of the unsung heroes, the people that work so hard over there and never get recognition for what they do. But we work together as a team and we succeed together as a team. And our success is really shared in the result of all the people that work there. Also would like to take a minute to thank Al Vandenberg, because I don't think there's a better county administrator anywhere than Al. And Al, I've appreciated the support and the encouragement that you've given us, your involvement with the health department. That's meant so much to us. And I personally want to thank you for your friendship all these years. I think if there's one thing that Lisa and I have been kind of disappointed though with you, Al, is the fact that you've had all this time and you haven't figured out a way to help Jim Harbaugh beat Ohio State. So you can work on that. And of course, I think most of all, I want to thank Lisa Stefanowski. I think you all know what a gem she is. Lisa and I have been together for 19 and a half years at the health department. And during that time, we've had some real challenges. In fact, the first challenge was about 2 months after I got here. It's when we had our first case of West Nile. We got through that, and we've gotten through things like Lyme disease and bird flu and H1N1. We've had to deal with multi-drug resistance cases of TB. We've had outbreaks of chickenpox and measles and hepatitis during that time. And we had some kind of weird things like Zika and chikungunya. And of course, I don't think anybody, at least we can't forget the norovirus outbreak at Hope College. And then of course, right now, we're faced with the worst pandemic in over 100 years. And then on top of that, we've had to deal with our normal routine chores over there. But through all of this, Lisa has been rock solid, and she's been given us stability and the energy to finish our job there. And I think one of the things I've liked the most about working with Lisa is that it's always been fun to come to work in the morning. And if you look at the organizational chart, you'll see that I report to Lisa, so that makes her my boss. And all these years, I've been telling her what a great boss she is, but I've also told her that she'll always be the second best boss I ever had, because the first best boss was a commander in the military, and I served under him at 3 different bases, and I knew she could never be better than him. But over the years, I've found out that I'm wrong. And Lisa, I just want to tell you for the first time ever, you're the best boss I ever had. And it's been a real honor to work with you. And I appreciate you so much. And I'm going to miss her too. I tell you, after being with somebody 5 days a week, 52 weeks a year, and 19 and a half years, you get to know them pretty well. And I am going to miss her. Just maybe we'll kind of wrap things up here. I just wanted to say that how tough it's going to be in a couple of weeks when I have to walk out the door at the health department for the last time, because I'm going to be leaving my family there. But I don't have any regrets. I have been blessed beyond all of my expectations and have been very fortunate in my career. As Roger said, I was fortunate enough to be a family physician up in Traverse City for 20 years. And one of the things we sort of specialized in there was obstetrics. And we delivered a lot of babies while I was up there. And I swear most of them came in the middle of the night, usually between 2 and 4 in the morning. And one of the things that sort of a side note to that is that the doctor that I took call with up there for 20 years on weekends and holidays and evenings, and probably the physician I had the most respect for and was one of my best friends, I found out later was actually Al's uncle. And in addition to doing the family practice, as Roger said, I was fortunate enough to have a very exciting a career in the military, both in the Air Force and the Air Force Reserves, which I will always be grateful for that too. And now I've had a chance to sort of finish a dream job here at the health department. It's ironic that I'm going to be, as I retire in a couple of weeks here, 49 years ago, almost to the day, my mother retired from the health department. She was a nurse for many years, and she finished up her last probably 12 to 14 years at the health department. And she loved her job here, just like I have loved mine. And I know that if my mother was here today, she would certainly understand when I tell you and thank you for making these last 19 and a half years some of the best years of my life. Thank you very much.
You're welcome. Dr. Heidel, I think you're going to need to come back up because I think the sheriff wants to see you. Keep your hands in your pockets, probably.
About those parking tickets, Doc. Doc, as sheriff, I never realized how important it was, the working relationships with you and Lisa and CMH, especially during this last year and a half. It's been tough, and I know the stressors have been on all of us. But Doc, one of the things that is allowed as a sheriff is to make people a deputy sheriff. And I would like to do that today. I did not check with Mr. Vanessen if this was legal or not, but we're going to make it legal. Very few of these have been presented over the years. This will be just the second one during my term as sheriff. But on behalf of the Ottawa County Sheriff's Office, this certifies the Sheriff of Ottawa County, Michigan, pursuant to the authority vested in him by the state of Michigan, designated, and I called you chief here. Chief Medical Director, Dr. Paul Heidel, is an honorary deputy sheriff in the County of Ottawa within the state of Michigan on this day, the 27th of April, 2021. So Doc, behalf of the men and women of the Sheriff's Office, myself, thank you.
Thank you.
And being a military man, you know what these are.
Oh, absolutely.
And I will find you one of these days and challenge you.
Okay.
So,
All right.
all
I
right.
don't have it, I'll buy the drinks.
Okay. And you're not going to forget us. There's a badge in there, but it's made out of plastic. Okay. I got to be fiscally responsible to the board and some other swag in there for you, Doc, just to remember us. And again, the relationship's just been absolutely wonderful. I've appreciated you. I've appreciated listening to your stories over the years, and you're going to be greatly missed.
So the feeling is mutual, and I
Thank you.
appreciate so much what you've done. This makes me feel like I'm right up there with Barney Fife right now.
You notice I can give you a wallet version if you need one in case you get pulled over. Just like that. Thanks so much. Thank you.
Thanks. The next thing on our agenda is Lisa, public health update. Lisa, how are you going to follow that? You know?
I don't think I can. All right, well, we can jump. Sorry, I'm gonna regroup a little bit here. Thank you for having me today. We'll jump right into COVID and I'll see if I can compose myself enough to say a few additional words. So I'm just gonna run through some statistics right now. We have, as of Monday, we've had 30,024 COVID cases in Ottawa County, 380 deaths, with a preliminary case fatality rate in Ottawa of 2.1%. We've had 878 total hospitalizations with a hospitalization rate of 2.9%. Our case counts and positivity just started to decrease a little bit this week. We saw a tiny little downward trend last week, but it was too soon to really say for sure whether or not that was a true downward trend. I think we're real close to being able to say that. So we're excited. We're happy about that. 2 weeks ago, our weekly test positivity rose nearly 20%, the highest level in over 6 months, but since then has decreased to 16%. So again, more good news. While hospitalizations are elevated, they're slightly lower than levels seen during the November wave, and deaths are nearly 60% lower than the November wave. Again, this is really good news, and in large part attributed to the number of people that have been able to receive COVID vaccination. Over the last week, we've been averaging about 143 cases each day, much lower than the previous 2 weeks where we saw about 220 cases per day. I think I kind of covered enough about the hospitalizations. I will mention schools. Cases in schools have been elevated, contrary to some of the information that's floating around out there. But again, the good news is they are starting to decline with the overall decline that we're seeing in the community. Most cases in schools have been among students, and vaccination appears to be protecting the staff, which is good. Early on in the pandemic, we saw a number of staff becoming ill, and now that they're vaccinated, we are seeing some pretty dramatic decreases in the staff population. We've had 2,262 cases of the B117 variant, which is the UK variant, that have been identified in Michigan. Over 11% of all B117 cases identified in the US today are right here in the state of Michigan. This is something that we continue to be concerned about. Like everything with a novel virus, meaning new, there are just so many things that we don't know about, and we have to be a little bit patient to take the time to gather the data, gather the information so that we can identify maybe some better practices than our existing best practices. Our vaccination is going very well. We've got a completion among people 16 and over. 37.8% of Ottawa is completely vaccinated, which is higher than the rate in Michigan. We've got 69.8% of Ottawa population at 65 and older, which we're almost to that 70% target, which is where we started off when we began vaccinating. We continue to run a lot of vaccine clinics throughout the county. We're continuing to work with our partnerships, not only in Ottawa County, but throughout the region to ensure equitable access to vaccine. We're seeing a little bit of a shift. I don't want to say we've hit a wall, but I think the people that were very highly motivated to get out and get vaccine have been able to get vaccine. And now we're shifting our strategy a little bit from doing these large clinics where people come to us to maybe doing some smaller clinics throughout the community, making it a little bit more convenient for those folks that aren't necessarily vaccine hesitant, but they're just not highly motivated to take the effort to get a vaccine. So we're just going to try to make it more convenient for them by going to where they are. So more to come on that. Ottawa has more to do, or more work to do with reaching health equity. We have had 9.1% of the people age 65 and older that are Hispanic or non-white in our vaccine clinics, and that's higher than the overall population in that same category. So we feel that our outreach efforts, all the work that's being done by our community partners is working, but we do realize that we have more work to do to make sure that people do have equitable access. Many of you, I'm sure, just in reading the news, you know that as of April 13, there was a pause in the Johnson & Johnson vaccine after a report of 6 cases of a rare, severe type of blood clot in individuals following the administration of that vaccine. During that pause, there was some very, very extensive medical and scientific research by the FDA and the CDC where they examined available data to assess the risk of the Johnson & Johnson vaccine. The teams at the FDA and the CDC also conducted extensive outreach to providers and clinicians to ensure that they were made aware of the potential adverse effects and could properly manage and recognize these events if they were to occur so that they could immediately respond and treat people that may have been affected. Today, or actually it was yesterday, the agencies confirmed that there were a total of 15 cases of this thrombosis that were reported in the CDC's system called VAERS. Those are including the 6 original reported cases. They were actually able to identify a few more. All of them occurred in women between the ages of 18 and 59, and the median age was age 37. And usually people reported symptoms after, well, between 6 and 15 days. Since that time, and looking at all the data, the United States FDA and CDC are recommending that we resume the use of Johnson & Johnson. They have confidence that this vaccine is safe and effective in preventing COVID-19. The FDA has determined that the available data show that the vaccine's known and potential benefits outweigh its known and potential risks in individuals 18 years and older. At this time, the available data suggests that the chance of TTS occurring is very, very low, but the FDA and CDC will remain vigilant in continuing to investigate the risk. Based on these findings, our department will reconvene the use of Johnson & Johnson. We are recommending, though, which is also in line with the FDA and the CDC, that mRNA vaccines should be prioritized over Johnson & Johnson for women between the ages of 18 and 49. And so Pfizer and Moderna would actually be what we would recommend for women in that age group from this point forward. I want to just mention again, I've said this before, but I think it's important. I continue to get many people emailing me and calling me, as I'm sure many of you are, in some cases, ordering us to reduce the mitigation strategies of COVID-19. First of all, I do want to acknowledge how difficult this pandemic has been on everybody. I feel for every single person in our community. I hear the tone, and I think it all comes from a place of fear. And I recognize that, and I feel a lot of compassion about that. I understand and hear this from people, that it's difficult for children to wear masks. We've heard when people have said that they believe masks can be dangerous. We know that school sports may be the most important thing in a child's life at this stage in their life. We understand that. And we know that they just want to play and maybe don't understand the difficulty associated with all these mitigation strategies. We genuinely feel for the young people that have experienced exposures and therefore, well, multiple exposures and therefore multiple quarantines. This is hard, taking kids out of school multiple times. I want everybody in the community to know that we've read and processed all the information that we've received in emails, and we've listened to the phone calls. In spite of sometimes being called names, we've been insulted, we've been badgered, but I want everybody to know that I respect people for advocating for what they believe. Sometimes people don't have all the information, and I don't know how to give people all the information. Infectious disease specialists have gone to school sometimes 6 and 8 years, and it's hard to help everybody in the community understand the complexity associated with a disease outbreak of any kind, let alone a pandemic where it's brand new and we just don't know. It's indeed a difficult time, and again, we're not going to get agreement from all 290,000 Ottawa County residents on how to best navigate a global pandemic. The challenge for us, and this includes me, is that there is still so much to know and so much to be learned about SARS-CoV-2 virus and the COVID-19 that the disease causes. Because of this, and because of what we do know about COVID, which is that it's brand new, meaning when it arrived, everyone was susceptible, that it's communicable and spreads quickly. It can cause serious illness, death, and long-term adverse health effects. We and I have a professional duty and a moral responsibility to act using well-researched communicable disease response measures that are supported by trusted organizations like the CDC, MDHHS, the American Academy of Pediatrics, the American Medical Association, all of our local healthcare systems in our area. And those mitigation strategies include masking, isolation, quarantine, social distancing, and hand washing. Out of an abundance of caution, we have to do these, and we have to be able to create a balance. I want you all to know, and you and everybody in the community, that we are advocating for everybody. We take the information that we get. We are collecting all this data that we report out to you every week. We provide that data to the state of Michigan so that they can help us to do the kind of research that's needed to make changes that could potentially relax some of the very strict feeling things that we've got going on in our life. We are forwarding that. We hear you. Public health officials across Michigan have been working tirelessly to protect our citizens and balance the rights of some against the balance or the rights of others. It's always a balance. One person wants it this way because they feel really strongly about it. Another person wants it this way and they feel really strongly about it. And we have to go back to relying on the data and the science. And we're trying to do the very best job we possibly can while considering the health and well-being of everybody. And that's social, emotional, physical health and well-being of everybody. The pandemic is affecting everyone. And I would just ask that when people decide to wear a mask, distance, hand wash, quarantine, remember that there are individuals in schools and communities that do not have the good fortune of optimal health. They may not have a strong immune system. They may not have protective genetic profiles. They may not have access to healthy food. They may not have health care insurance. They may not have some of the same protective measures that maybe some of you and I have that allow us to have a, mild case of COVID. And just remind everybody, and I appreciate so much the prayer that Matt shared at the beginning of this. And I will just say again, be kind, be generous, give grace and forgiveness where you can, be patient and try understanding. We all have differences of opinions. We look at different sources of information, but we're only going to get through this if we come together instead of being divided. And I can make a promise that I will always continue to treat people with that kindness, grace, generosity, and forgiveness. And I'm trying to be patient too. And I will continue to do that as long as I am in the health officer spot. Lastly, this is a hard part. I do want to take a moment to give my most heartfelt thank you to Dr. Heidel, I call him medical director extraordinaire. As he mentioned, for 20 years we've worked side by side. We've led the organization together. We've worked so hard to ensure conditions for our community to be healthy. And as he mentioned, sometimes it was hard. Sometimes it was good. We had lots of successes. And, we can sort of brag and say we've been the healthiest county in Michigan for a number of years. And so I'd like to think that we had something to do with that, right, Doc? I'm so thankful to have been his professional partner, and I will miss him for his excellence in medicine and public health, for him challenging me and challenging our team, for his amazing way of connecting with people and connecting with our community. He's always listening and responding to really everybody's needs, everybody, for being a man of incredible integrity. He's also been such an amazing friend who has been able to balance the seriousness of work with the important need of a little workplace joy and laughter. I thank him for that most of all. On behalf of our entire team, and because of COVID and social distancing, we would have loved to have packed the room and shown him the support, but we can't do that. But on behalf of every single person in the Ottawa County Department of Public Health, we want to thank him. And we want him to know that he will always be part of the Ottawa County Department of Public Health family. Also, thank you for all the popcorn and the chocolates and the decent coffee and, all that good stuff too. So thank you. Any questions for me?
Any questions for Lisa? Yes, go ahead.
Lisa, first of all, again, thank you for the work that you and your team are doing. I had an opportunity this week to field a couple questions, and the same questions seem to be coming up to some of my emails or text or whatever. There are some people that think that Ottawa County Health Department adds on extra stuff than what the state is mandated. Could you clear the air on that? I mean, we're not adding on extra rules. I mean,
no. There are a couple different things. So there are the executive orders, which, as all of you know, is sort of the equivalent of a law. It's a mandate. We have to perform within the construct of the executive orders. And in some cases, it means that we have to enforce those orders. It's a responsibility. It's a duty. It's written right into the public health code. The other part of what we do that's written into the public health code is sometimes put in the form of standard operating procedures. And there are specific standard operating procedures for COVID. Now, could another county perhaps interpret some of those standard operating procedures differently? They may. It's not often, but they can be interpreted slightly. In many cases, the interpretation would be based on maybe different case levels, different hospitalization rates, different death rates. But we all of us as health officers try to work very closely together to make sure that we are consistently applying the laws, the mandates, and standard operating procedures as it relates to not just COVID, but all communicable diseases and all mandated programs that we have to provide. So I hope that answered your question.
It does. Thank you very much. And
Yes.
Like I said, I hope it's a question that we can all, share with people that, we're doing what we're told and expected to do, that we're not adding on to the pile here. So
sure.
Thank you.
And Doug could probably address this too. There's risk in deviating from those administrative rules and even the standard operating procedures that are put out by the CDC and MDHHS. It's never really a good idea to go off on an island without the backing of those organizations that are setting those policies based on a whole bunch of really important information, without the knowledge that your actions would do no harm. And that's the business that we're in, do no harm. And we're trying really hard. And I know there are people out there that think that, there are some things that in the mitigation strategies currently that could potentially do no harm. However, we don't have any evidence of that. And we're following, like I said, those really trusted organizations that are doing the research and compiling it and analyzing it and giving us those standard operating procedures and those rules that we need to follow.
Anyone else? Mr. Danberg?
Lisa, my wife and myself pray for all the county employees every day.
Thank you.
I do want to apologize of the citizens that do not treat you with respect, or any of the other employees. You're doing a difficult job. A lot of them are. We are very proud of the job you do. So thank you.
Thank you so much, Al. Thank you. And again, I'm not excusing bad behavior by anybody. However, I get it. I mean, it's hard. People are very frustrated. But I do go back to what I said. I don't think that we're going to get through this by attack. I think we need to come together. We need to recognize that we're all in the same boat. It's not great for anybody. And we're all doing the best we can with what we know and also what we don't know.
Mr. Garcia?
Lisa, I think I heard you say that folks who were waiting for their vaccine have been able to get their vaccines and so forth. I hear that we're getting to the point that now where we have folks who don't have what the convenience maybe because of work and so forth. Are we working with our large employers to be able to do the vaccines at the sites of work?
Yes, that's a great question. Early on, actually throughout this whole thing, except for in the beginning when we had certain prioritized groups. Now that it's open, we have been working with our pharmacy partners to work with corporations. So they get vaccine too. So we've sort of divided up our responsibilities a little bit while working together. And we've been doing the community-based clinics while allowing our pharmacy partners to go in and partner with local corporations. We did some of our food processing plants. We've done a couple farms. But for the most part, the corporate manufacturing places have been done by pharmacies. Now, having said that, we know that there are more. Some of our pharmacy partners don't want to go in for less than a certain number, like, for example, 500. If they can't do 500 vaccines, it's just not cost effective. Now, that's where we may step in to provide some smaller kind of, we're calling them pop-up clinics, where we could go in, and if they have, 50 or 100 that need a vaccine, we can, put up our little vaccination station. Or we now have a little van that we take around, and we call it the Vaxi Taxi, and provide vaccinations and kind of smaller venues. But yes, we are definitely working very closely with our business community.
On a side note, Lisa, I also want to follow up with Al's comments. I think that you folks have done an excellent job. And I remember a year and a half ago when we were on a committee, and your smiley face was always something to look forward to at the health committee meetings. And it's going to take a while for us to be able to see that smile more often. So it'll happen. As of yesterday, my daughter, my son, my wife, and I have been fully vaccinated. My 94-year-old mother that I haven't seen in a year and a half as well.
Oh, that's
So
fantastic.
I hope that one day I'll be able to travel before time elapses where I won't be able to see her. So I also encourage people to go out there and just get vaccinated.
Yeah, thank you for that. Yeah. Even my 85-year-old parents got a vaccine, and they were reluctant in the beginning. And, they had to learn more about it. And I respected that. And they got theirs a few weeks ago and are doing just great.
Anyone else?
Mr. Chair, I'm hoping we
On
can
Zoom?
test the audio again and see if Commissioners Holtvluwer and Zylstra.
Doug, can you just say hi?
Hi, Lisa. How you doing?
Jim, you want to try
Hi,
it?
Lisa. Can you hear me?
Bye.
Okay, good.
Thank you.
All right.
So Lisa, I have one question.
Okay.
Actually, I had two, but I think you've answered already the possibility. I was thinking about the migrants as they come to work on some of the farms. Will you potentially go to some of those farms with your Vaxi Taxi?
Yeah, potentially.
Okay.
Yeah.
Okay, good.
We
then
we
the
will,
other
and we
question-
already have. So we've started that already, and we've got a relationship with the state. There's a little more to it than just us, but we're working with a number of partners, Intercare, MDHHS, and us. And between the three of us, we're gonna get it done.
Good, good. Then the other one I had was, how long do you see before younger ages will be able to have the 12 and
Yeah.
up?
They've been vetting that. Do either of you have any more information on that?
They're thinking about after this fall to be able to.
Not till the fall?
We're kind of hoping for this summer so that we can
Yeah.
get those vaccinations done before the school year. It's been so tough on the schools. Oof.
Yeah.
And
Yeah.
parents and kids.
Okay. All right. Okay. Anyone else? If not, thank you so much, Lisa.
Thank you very much, all of you.
Next thing on our agenda is public comment. Is there anyone in the audience that would like to speak to the commission at this time? Do you have anyone online that would like? Okay.
Sir, we have a couple of comments, and I'm going to go ahead and ask you to unmute and just state your name and address for the record. And you have 3 minutes.
Hello.
Yep, we can hear you.
Yes.
All right. Hi. My name is Karen DeVries, and I live at 396 Fair Hill Court in Holland, 49423. And kind of regarding some of the comments that Lisa made as far as the Ottawa County following the CDC guidelines and the NDHHS, what I'd like to know regarding schools is the CDC has recommended to down from 6 feet to 3 feet social distancing. And I'm wondering why Ottawa County has not, followed that. And then also the CDC, I believe, has 10-day quarantines recommended instead of 14. So why are we staying at 14 days if we're following CDC?
Okay. Anything else?
No, I just think that affects the mental health of our kids because we've changed it from 10 to 14 to 10 and back up to 14. These kids that are being quarantined over and over again, that's a lot of time to be out of school. And I think 10 days seems to be more than enough if we're following the guidelines like was stated.
Okay. All right, thank you.
Yep.
Who is next?
Okay. I believe we have Stacy, and we're going to ask you to unmute Stacy and just give us your first and last name, and you have 3 minutes, and address. I'm sorry.
Hi, my name is Stacy Langstruck. Can you guys hear me okay?
Yes.
Yes, okay. I live at 7297 Medina in Hudsonville. My kids attend all areas of Hudsonville schools. We have one at the ECC, 4 in Albert Elementary, 1 at Baldwin Street Middle School, and 1 in the high school. And along with the question that the sweet lady just asked, I also am wondering with athletes, if they're being tested on Sunday nights, having a negative test, they're wearing a mask, they're doing everything that they're supposed to do, why are we still contact tracing all these kids? I guess I don't understand, and I can't get an answer from the school, from the health department. I get nobody to call me back. Like Ms. Lisa just said, everyone is very, very frustrated. We are the most locked down county. Nothing's consistent. My daughter has been contact traced for the 3rd time and had a negative COVID test on Sunday. And it's just absolutely absurd. My son has asthma and he's 4 and now he has to wear a mask. There's no reason for these insane lockdown and mandates when a county over in Kent County, it's completely different. It's just very, very frustrating. And after listening to this meeting, I'm probably more frustrated than I was before. Like, it's just appalling that you guys can all sit there and not care about our kids and say, put on a mask, go get a vaccine. But when you do that, nothing else happens. Nothing. We get nothing from it. No more freedoms, no more time, no more sports. It's still contact tracing. Everybody's out of school. Do this, do that. It's just nothing. And I would just really like some answers.
Thanks, Stacy. Who's next?
That is all, Mr. Chair.
Okay, all right. Is approval of agenda. And I would like to add under the discussion, we're going to add an item called PACE, a discussion regarding PACE, correct, Al?
Yes.
Okay, so that one addition to our agenda. So could I get a motion, please?
Support.
Been moved and supported. Comments or questions? Call the roll, please.
Yes, sir. Mr. Fenske.
Yes.
Mr. Zylstra.
Yes.
Mr. Hvac. And Mr. Garcia.
Yes.
Holtvluwer.
Yes.
Mr. Baumann.
Yes.
Mr. DeYoung.
Yes.
Mr. Meppelink. Mr. Dannenberg.
Yes.
Mr. Terpstra.
Yes.
And Mr. Bergman.
I vote yes.
Motion passes.
Next thing is action and reports, consent resolutions. Mr. Fenske.
Thank you, Mr. Chair. I will move to approve consent resolutions 1 and 2.
Support.
Been moved and supported. Comments or questions? Call the roll, please.
Mr. Zylstra.
Yes.
Mr. Fenske.
I vote yes.
Mr. Baumann.
I vote yes.
Garcia.
Yes.
I vote yes.
Mr. Dannenberg.
I vote yes.
Mr. DeYoung.
I vote yes.
Mr. Holtvluwer.
I vote yes.
Mr. Terpstra.
Yes.
Mr. Bergman.
I vote yes.
Motion passes.
Under public hearings, there is none. Action items from Finance Administration. Mr. Baumann.
Thank you, Mr. Chairman. Regarding the fiscal year 2021 budget adjustments, I make a motion to approve the fiscal year 2021 budget adjustments per the attached schedule.
Support.
Been moved and supported. Someone should call the roll, please.
Mr. Baumann.
I vote yes.
Vote yes.
Mr. Meppelink.
Vote yes.
Mr.
I vote yes.
Mr. DeYoung.
I vote yes.
Mr. Zylstra.
Yes.
Mr. Terpstra,
Yes.
Mr. Dannenberg,
I vote yes.
Mr. Fenske,
Vote yes.
and Mr. Bergman.
I vote yes.
Motion passes.
Regarding the County of Ottawa financial report with Radeveld Hefner LLC, I make a motion to receive for information the comprehensive annual financial report of the County of Ottawa for the year ended September 30, 2020.
Been moved and supported. Comments or questions?
Mr. Chair, we do have Peter Hefner here
Yes.
from Bradeveld
Yes.
Hefner, and it would be good for him to
Yep.
make a few comments.
Yes. Peter, you're on.
Thank you, sir. Can you hear me okay?
Yes.
Gotcha.
Patiently waiting all this time. So we look forward to hearing from you.
Thank you. Appreciate the opportunity to be here. I met with your finance committee about a week ago and went through the audit in some detail. And I wanted to touch upon some of the highlights today. So I will just point out that we provide 3 opinions on your financial statements and your federal compliance. And in each case, we provided an opinion that is unqualified. Excuse me. No material weaknesses identified, no significant deficiencies in your internal controls over compliance or your internal controls over financial reporting. And so those are the 3 opinions that are what I would be looking for as a board member. So that's positive. This year we audited 3 federal programs covering more than 50% of your $16 million of federal financial assistance. Some other highlights, your other post-employment benefit plan this year was fully funded. Actually, it was 104% funded. Your pension plan is 78% funded, which I would say is in the top third of those organizations that we work with, and we work with nonprofit and governmental entities only. This year, your net position of your governmental activities, so a business perspective of all of your governmental funds, increased the net position by approximately $3.5 million. Your business type activities, which is the delinquent tax collection fund, increased net position by $1.3 million. And your governmental funds increased fund balance, which represents expendable available financial position, increased by approximately $4 million in the current year. And I went through quite a bit of detail with the finance committee. We went through a lot of detail with your staff, and I want to thank them for their preparation for the audit. And your audit includes many component units such as the road commission, the public utilities, the insurance authority, water resources. So quite a process. And I would just compliment your staff, Karen Karasinski and her staff, in the preparation of the financial statements for the county. I have 2 clients that prepare their own financial statements, and takes a lot of expertise, and they were able to put that together. So my compliments to them and thanks to them. Are there any questions I can answer regarding the financial statements or the audit process?
Any questions for Peter? Peter, you did a great job. So we don't even have any questions for you. I think that says something about you.
Oh, thank you. And then we do truly appreciate the opportunity to work with you again. Thank you.
Thanks. All right, ready to vote?
Ready.
Justin, would you call the roll, please?
Yes, sir. Mr. Terpstra,
Yes.
Mr. Holtvluwer,
Yes. Vote yes.
Mr. Zylstra,
Yes.
Mr. DeYoung,
I vote yes.
Mr. Meppelink,
I vote yes.
Mr. Baumann,
I vote yes.
Mr. Fenske,
I vote yes.
Mr. Dannenberg,
Vote yes.
Mr. Garcia,
I vote yes.
and Mr. Bergman.
I vote yes.
Motion passes.
Regarding the local government retirement system annual report, I make a motion to receive for information the local government retirement system annual report as required by Public Act 202 of 2017.
Support.
Been moved and supported. Comments or questions? Justin, would you call the roll, please?
Mr. Holtvluwer,
I vote yes.
Mr. Garcia,
Vote yes.
Mr. Dannenberg,
Vote yes.
Mr. DeYoung,
I vote yes.
Mr. Zylstra,
Yes.
Mr. Terpstra,
Yes.
Mr. Meppelink,
I vote yes.
Mr. Baumann,
I vote yes.
Mr. Fensky,
I vote yes.
and Mr. Bergman.
I vote yes.
Motion passes.
Regarding the Fulton Street HVAC replacement project, I make a motion to approve the lowest responsive bid from Hearst Mechanical in the amount of $85,316 to replace 3 rooftop units in the building control system.
Supported.
Been moved and supported. Comments or questions? Justin, would you call the roll, please?
Yes, sir. Mr. Garcia,
Vote yes.
Mr. Fensky,
I vote yes.
Mr. Zylstra,
Yes.
Mr. Dannenberg,
A yes vote.
Mr. Terpstra,
I vote yes.
Mr. Meppelink,
I vote yes.
Mr. Holtvluwer,
I vote yes.
Mr. Baumann,
I vote yes.
Mr. DeYoung,
I vote yes.
and Mr. Bergman.
I vote yes.
Motion passes.
Regarding the facilities maintenance personnel request, to make a motion to approve a proposal to hire 3 part-time, non-benefited housekeepers at an annual cost of $43,641.69.
Supported.
Supported. Comments or questions? Justin, would you call the roll, please?
Mr. Dannenberg,
A yes vote.
Mr. Baumann,
I vote yes.
Mr. Fensky,
I vote yes.
Mr. Meppelink,
I vote yes.
Mr. Terpstra,
Vote yes.
Mr. Garcia,
I vote yes.
Mr. DeYoung,
I vote yes.
Mr. Holtvluwer,
I vote yes.
Mr. Zylstra,
Yes.
and Mr. Bergman.
I vote yes.
Motion passes.
Regarding the county treasurer's department personnel request, I make a motion to approve the reorganization request from the county treasurer to remove the 1 full-time equivalent unclassified U4 position of revenue accounting supervisor and add a 1 full-time equivalent group T6 clerk position at a cost savings of $22,324.82.
Supported.
Been moved and supported. Comments or questions?
Mr. Holtvluwer,
I vote yes.
Mr. Meppelink,
I vote yes.
Mr. Terpstra,
I vote yes.
Mr. Garcia,
I vote yes.
Mr. Zylstra,
Yes.
I vote yes.
Mr. Dannenberg,
Yes.
Mr. DeYoung,
I vote yes.
Mr. Baumann,
I vote yes.
and Mr. Bergman.
I vote yes.
Motion passes.
Regarding the merit contract for broadband data collection, I make a motion to approve the contract with Merit Network Incorporated to complete Phase 1 of data collection and analysis of the county's multi-phase digital inclusion strategy at a cost of $42,000.
Supported.
Been moved and supported. Comments or questions?
And I have a quick question. Is this something that would be covered under the care package or under the COVID dollars possibly, or?
It possibly could be, yeah. So I mean, if when the requirements or the standards, regulations come out, if this is something we can back fund, then that would be maybe an opportunity to pay ourselves back for that.
Okay.
Anyone else? Justin, would you call the roll, please?
Yes, sir. Mr. Fensky,
I vote yes.
Mr. Zylstra,
Yes.
Mr. Garcia,
Vote yes.
Mr. Holtvluwer,
I vote yes.
Mr. Baumann,
I vote yes.
Mr. DeYoung,
I vote yes. Yes.
Mr. Dannenberg,
I vote yes.
Mr. Terpstra,
Vote yes.
and Mr. Bergman.
I vote yes.
Motion passes.
And finally, regarding the waiver and reduction of food establishment license fees, I make a motion to approve the motion to waive the food license fee for 33 establishments that paid for a food license and have not operated during license year May 1, 2020 through April 30, 2021 in the amount of $13,611, and to reduce the license fee for all food establishments renewing a license in 2021 in the amount of $141,611.
Supported.
Been moved and supported. Comments or questions?
Mr. Chairman?
Yes.
Yeah, I have a question, or a comment, I should say, on this. I think this is admirable that we're doing this. I like it, but I believe it's not gone far enough. And I don't know if there's possible, I'm not sure Robert's rules, if it could be an amended motion or if that's even possible, but I think it should be waived. The license fees for the food establishments for this year. And I think they're still operating at reduced capacity. And I'm just, it's a lot of money. I understand that. And maybe it's something like Al just alluded to on the previous motion that we could charge back for later. But I would be really in favor of amending that motion and seeing that license fees go away.
Mr. Chair, I'd second that motion.
Okay, so just so Al, you want to just bring up the
Yeah,
fact
I can.
that they can
So
also,
that would be relief of about $500,000. And we may be able to recoup that. I think the logic behind this was that basically this doesn't make winners or losers. It doesn't differentiate restaurants that maybe made a lot of money during COVID versus ones that didn't, or anywhere in between. That by rebating the amount that people paid for a license and never operated made sense. And then also the amount that we did recoup we got 30% basically from the money for coronavirus, and passing that right through to the restaurants that have licenses for the next year. The other thing is we thought it'd put everybody on an equal playing field for everything else, because there's a lot of other types of businesses that suffered greatly during COVID, that we have figured that a portion of the 57 million would be set aside. We'll probably have that money in hand within a couple weeks. I'm not sure when the regulations are going to come out. And then every business would be able to apply for relief. So if restaurants that were damaged more than others, maybe that made money during COVID wanted further relief, then they would be able to apply for that through the 57 million.
Mr. Chair?
we do have a motion on the floor, but go ahead. So, go ahead.
I read an article, Kent County waived 100% of the licensing fee. So, I agree with the motion that's on the floor that we should, look at waiving or just waive 100%. These restaurants, businesses have gone through a lot. A lot of them haven't had a paycheck. All of us have received some type of pay or benefit through this hard time. And I really think that we should waive 100% of it.
Anyone else want to make a comment?
Yeah, Mr. Chair, I agree with Commissioners Terpstra and Randy there. A lot of these smaller entities, did not receive PPP. They're not likely to receive ARP funds. We have food trucks and school concessions. So I do think this is, if we go to 100%, like Randy says, I think that's, kind of a move to a more equitable relief. I'm not sure what supply, needs are for a school concession, but if we would give them relief, that could be a good start for their summer season as far as buying inventory, et cetera.
Yes, go ahead.
Mr. Chairman, I know we have some monies coming, sometime else in the next couple of weeks and stuff like that. I like the motion as it sits today. I wish it was more. We take a lot of leadership from what Karen and her team brings to the table here as far as what we can afford, what we can't afford. I'd like to support this today, but also with the understanding that if we do get the 57 million, that we take another look at this and maybe consider at that time, some more. In the meantime, I did have a chance to talk to a couple different restaurant people. I spend way too much time in the restaurants, but I asked people about this, and they're very appreciative of this. Okay. Mm-hmm. Yeah, sure. Would they be more appreciative of all of it? Yes. I think this is a great place to start, with the understanding that we take another look at this if we get the 57 million and we can possibly use that for that.
The only other comment I'd make is that Kent County did receive $114 million. The 5 biggest governments in Michigan back in April last year did receive 114 million, and I know that they have not spent all of that. And so they do have resources to do that type of thing without using taxpayer money to actually subsidize something like that at this point. So they're still using the CARES Act money to give that kind of relief, not general fund money. That'd be the big difference, I would say.
So we would be using taxpayer dollars.
We would, because this would cost $500,000, and we wouldn't be using taxpayer money if we do what we proposed, because we're basically passing through money that we've received from the CARES Act to cover some of those costs and the deficit in rates.
Al?
Yeah, Al, can I make a comment on that? I'm not sure exactly what Randy had, referenced as far as funding sources, but, I think we talked about this in finance, and am not at all inclined to use general fund money for this, but we do have $57 million coming in, and we know that, you know, we have fairly wide latitude as to how we can spend that. So, you know, if you're not saying ARP money is taxpayer money, I do believe that it is. Obviously, eventually it comes from someplace, but if we're getting 57 million and we have the chance to do relief now at 100%, I don't think we're touching the general fund because we'd be using ARP money that we'll be getting soon within a matter of weeks. To send one check as opposed to a 30% check and then maybe a 70% check later on. You know, I don't know how easy it is for finance to do, but, you know, sending one check for 100% seems, you know, much preferable than to do two checks, you know, at two different times.
All right, thank you. Al?
I'll
get to you.
I also ran into a restaurant Saturday night and I talked to the owners and I said, I think you're getting a third break on your fees. And he said, thank you, but it's not really necessary. He said, we're doing good this year. It was rough last year, but he says it was good. He says, we have a very good working relationship with the health department. He liked that. Okay. His wife did say, oh, I don't know how they're going to do that because I already paid. So Al, how is the fees structured? Is it a calendar year? Like when do they get the bill?
That starts May 1 through April 30.
Okay.
And so if somebody did pay, then they would receive a rebate, but I don't think they've technically been billed for that yet. So
are we talking about the year 20 and 21?
this would be, it's 21, so it's more of 21 to 22.
Okay. Okay,
May
so they
1 of
haven't paid
21
that one.
through
They,
April 30th.
they paid the one from 20 to 21. Okay, so this is all for the future, right?
Yeah, I should mention one other thing. So Lakeshore Advantage, of course, is our economic development partner. They've been involved with this distribution of funds twice now with COVID-related money, SBA money, and they have documented unmet needs of business in the county. And so again, I think one of the philosophies behind this, as a fairly conservative county financially, is that if some restaurants really did well during COVID. Mm-hmm. There's just no doubt about it. And so Lakeshore Advantage would help us by looking at the unmet needs of all businesses in Ottawa County. Then all businesses would have so it might be that some restaurants might not actually qualify for some of the ARA money, but I'm sure quite a few will. But then there might be another kind of business, like maybe a shoe store, or maybe a
barbershop,
gym, or
beauty salon,
or a beauty salon that was really harmed, and so then they would have everybody would be on an equal playing field, I guess, is what we were recommending.
Okay. Hotels.
Yeah.
Yeah. Another issue.
Go ahead.
If I could just jump
Doug?
in here a minute. One of the things I was asked to do was look at the legality of a potential waiver of fees for this year. And the concerns that I have legally have pretty much been advanced already in this discussion. So the legislature has said that we want counties to take the effort, the expense that they incur for food establishment investigations and inspections, and charge that not against the general fund, but fee-based. And fee means look at your expenditures to do that work and charge that community what it costs. So when we got this request to take a look at the inequity of last year, we looked back at the costs that you determined in 2019 for this expenditure of effort by the county. With the 33 establishments, we expected to inspect them, charge the fee, they paid the fee, they got no service because they were closed. So we thought for those three, we should not charge them this year to make up for the fact that we overcharged them for the services that we didn't perform last year. For the rest of them, we did the inspections, we incurred the costs, but we got 30% reimbursement from the feds for that. It didn't seem fair to overcharge in your 2019 assessment, you were expecting 100% fee pays for service. We got 70% fee paid for service, 30% elsewhere. So we're rebating that money to them because it's not fair that we, in effect, double dip for that 30%. To Commissioner DeYoung's point, if we get the 57 million, we don't have it yet, you know, and we end up funding 100% of the inspection services for restaurants for 2021, then I would expect next year you can do a rebate for everyone for 2022. This is a rational way of protecting the general fund against inappropriate expenses, protecting the statutory scheme here, and yet doing justice to this element of the community that you know, maybe needs some relief, and frankly, on a fee-based system, deserves some relief if we get the funding elsewhere. So, you know, I hope that you pass this motion. I think absolutely we can reconsider if the 57 comes in and we are able to cover these costs on a non-fee-based service. But I think what we're doing here makes sense to everyone in our community, including those general fund taxpayers. Thank you.
All right, thank you. Any other comments or questions? Okay, so the first motion is the one that Randy brought up.
Correct.
So if we deny, if we turn that down, then we go back to the motion that Joe brought up, correct?
Can I just make a clarification, Mr. Chair?
Yes, go ahead.
And I imputed, Randy, to your motion, the funding source. Would the funding source be general fund money or ARP money?
Well, right now you don't have ARP money to spend. I mean, once we have ARP money in our accounts, and once we understand the rules by which it must be spent, then you would have the authority to allocate those funds. But currently, right now, we don't have them.
Can't say.
So if you did that today and we gave the relief immediately, it would come out of the county general fund.
Right. I guess the question is, can the motion to read that 100% with the idea that upon receipt of the ARP money, I guess?
Then we would probably wait to give the relief until we receive the ARP money.
Can't vote on something you don't have.
And we really shouldn't vote on it today.
Nope, that's right.
Mr. Chairman, I agree with what Doug said. I mean, if I can amend my motion to say that, provided we get the ARP money, I think that would be, you know, we go with the Commissioner Bauman's motion as is, unless we get I like what Greg said. I mean, I think that, you know, if not to just revisit it, but say, let's do it if we get the ARP money. And
okay,
I'll second the revised motion then.
Okay, all right, we can do that. All right, so okay, go ahead, Joe.
I just have a question though. So what we're doing is it's all or nothing, is my understanding, that if the ARP money comes through, but the feds say you can't spend it on this, then all bets are off and the restaurants aren't going to get their 30% rebate.
Mr. Chair.
I would much rather rebate their 30% now and visit this when we have the money and we have the rules, then come back and go, okay, let's do the other 70% or let's do 50% or that. We've got the 30%. Let's give that to them now and visit it at a later date.
Okay, Doug, one more comment and then we're gonna vote.
Again, I mean, it's Randy's motion, so I don't want to impute to his motion.
Okay, all right.
My understanding of his motion is, of course, we're going to do 30%. And if the ARP money comes soon within a week, couple weeks, then we can go 100%. And if that doesn't come, then the checks for 30% would go out in 2 weeks. That's my understanding of the motion. Again, it's not my motion to make, so I just second it.
That's not the motion.
No, the motion
is 100%.
is to give 100%, correct?
motion would be to give 100% provided we get the ARP. If we do not get the ARP money, then we can go with the 30%.
Okay, I will second that motion, Randy.
Okay. Okay. You got it?
No, I
Everybody
don't
understand what
have
the
it.
motion is?
You know, I
It
guess
just got,
I,
it just got revised.
right. I guess I'm struggling with all of these motions and amended motions,
Yes,
but I'm also struggling with the concept of 100%
yes.
for food establishments who are probably making more now than they were prior to COVID. When I leave my house to go visit my daughter, I pass 3, 4 national chain food organizations, and the lines are ridiculous.
Yes.
With no employees inside cleaning tables or picking up or whatever. So, so I think I would need a lot more discussion even to support a motion like Randy's at this point, because I don't have enough information and definitely have a lot of questions.
All right. So unfortunately, Frank, we're going to vote on that.
Yes, no, I know.
We're going to vote on
I'm
that.
just giving you a heads up.
And all right. So here, we're going to first vote on that question. If it's turned down, then we're going to vote on the original motion. So,
All right.
you got that, Justin?
I'm earning my salary today. It's good. Got it.
Okay. Justin, on the motion.
So can we read the motion that we're voting
Read
on
the
right now?
motion.
So we don't have it all written down. We're going to go. Yeah. Absolutely.
Sherry,
I can restate it in my own words.
Apologize for making it.
okay, Sherry, you're going to have to say it real loud because, yep. Yep. You can do it, Sherry. Right into the motion.
Okay, like I said, I'm gonna have to tweak this a little bit because it was all over the board.
Yes,
but-
no. But the
Okay.
final one is what we want to hear.
Okay, Mr. Meppelink moved to amend the first motion. I've got to get the number for it. And to waive 100% of the license fee for food establishment this year, provided that we get the ARP money.
Okay,
That makes sense?
yes.
Okay.
All right.
And then the 30%, if not.
Right. So we still want to include the.
Yes. It
That's a
also
separate
needs to
motion.
include the 30% if we
Automatic.
don't get the money. Yes. Yes. Okay. Got it, Sherry?
Yeah.
Okay.
Mr. Terpstra has a question.
Yes.
I just gotta, can't we just leave it as it is and then just add that if we get the money, 100% of it? So just
Good,
add
but we're
that
gonna
at the
go,
end, or-
we're gonna go with the motion. Sorry.
We,
Yeah.
Justin, would you call the roll on the motion that Sherry just read for us?
yes. Mr. Joseph F. Bauman,
I vote no.
Mr. Garcia,
I vote no.
Mr. Meppelink,
I vote yes.
Mr. Holtfluer,
I vote no.
Mr. DeYoung,
I vote no.
Mr. Zylstra,
Yes.
Mr. Terpstra,
I vote yes.
Mr. Dannenberg,
I vote no.
Mr. Fensky,
I vote no.
and Mr. Bergman.
I vote no.
Motion fails.
Okay, so now we're gonna vote on the original motion, which is the one that,
Joe said first.
all right. Justin, would you call the roll, please?
Sir, Mr. Zylstra,
Yes.
Mr. Fensky,
Yes.
Mr. Bauman,
Yes.
Mr. Garcia,
Vote yes.
Mr. Meppelink,
I vote yes.
Mr. Dannenberg,
I vote yes.
Mr. DeYoung,
I vote yes.
Mr. Holtfluer,
I vote yes.
Mr. Terpstra,
I vote yes.
and Mr. Bergman.
I vote yes.
Motion passes.
All right, next thing is appointments, none, discussion items. Ottawa County Equalization Report. Michael's been patiently sitting
Yeah.
back there way in the corner. Michael, you're up. Please take your mask. Yeah, thank you.
I'll keep it really short. At your first meeting of the month, you handled all of the statutorily required duties of setting county equalized values, signing the forms. That's something the board's required to do every year. At this meeting, I'm presenting you with the equalization report. It's a book of charts, graphs, numbers that the treasurer's office uses, local taxing authorities use, accountants use to pull numbers out of. Hopefully you'll find some value in some of the numbers in the book as well. And with that, you can all read. So if you have any questions or comments, I can answer those rather than just go through pages in the book and read them to you.
Good. That was a really good report. You can all read, so.
It's on my
Okay.
reading list.
Since everyone has read this, anyone have any questions?
No. I looked it up and the county is going up, right? So we got more money coming in.
Yes. By 4
Michael, you do a great job, because you only got that one question.
Do a great job. His whole team does. So yeah,
We got a good
absolutely.
department and the board supports the department. When we went to do local assessing, you said you can do it, but do it right and do it well and make sure you charge what it costs. That doesn't happen in a lot of counties. So we appreciate that as well.
Thank you,
Thanks.
Michael. All right, the next thing is PACE. Al, you're up.
Yes. So today, and we had kind of toggled back and forth between work session or discussion item. I think this will be of a length that's a little more worthy of a discussion item than a full work session. We're going to talk about the Property Assessed Clean Energy Program, PACE. And this is a Michigan law passed in 2010 that allows private landowners to voluntarily enter into a special assessment agreement with a local unit of government with an established PACE district, so a city or township, to secure private financing for energy efficiency, water efficiency, and renewable energy projects. So this law does not apply to residential projects unless they offer 4 units or more. Because project financing is secured with a special assessment, the loan runs with the land, not the landowner. There is no cost to the local unit of government to offer a PACE program to its landowners. There's no cost to the county. The county's more of a gatekeeper role in approving these. Each one of these comes up would have to be approved by the county board. Lean and Green Michigan creates a public-private partnership with participating local units of government to implement the PACE program. There's, again, no cost to the local unit of government to engage with Lean and Green for their services. Those fees are paid by the landowner at closing. So this is more of kind of a gatekeeper role to allow access to a program, because that's how the program was set up with that requirement. Becky Hudding is here, and she is going to, she has a few words, and she's going to introduce a couple folks that are online that are going to tell you more about PACE.
Yep, thank you, Al. This will just be real brief. We have some really good experts here online, but I'll just kind of frame up why this is coming before you today. Paul has a folder in his office about PACE, and he knows quite a lot about it. And then a few weeks, probably a month or so more now back, we got an email from Holland Township. They have a developer in their area that has done projects utilizing PACE in other states. They want to propose a project in Holland Township and would like to use it, but there isn't a PACE program or PACE district in the county. So they went to Holland Township and visited with them about that. And Steve Baltheis contacted us and said, what do you think? We were going to do some homework. So we contacted Lean and Green, who is the only implementer of this program in the state. It's not something you have to do. It's just something that makes it simpler to administer. So we contacted them and visited with them a little bit, and very quickly realized that if we were to establish a PACE district for landowners and developers to take advantage of, it would make a lot more sense to do it at the county level. So the county's boundaries would be the district, and then any local unit in the county would be able to access it, as opposed to having just Holland Township establish a district, have that one project, and then have the next township over realize that's a really good thing, and they want to do it, and then they have to establish a district. So that's why we'd like to entertain it at the county level. So I don't know how much any of you know about PACE or if you've experienced it before, but the folks from Lean and Green Michigan are online. Elise is going to do a very brief presentation. She has quite a few slides in her deck, but she's going to go through them real quick. She's going to keep it to maybe 10 or 15 minutes. And Todd Williams is also on. He is an expert on all of the nitty gritty. He's walked me through some of the nitty gritty. And then what I'd like to do is follow up if we decide to move this forward, is I'll put together a packet of information that once you're more familiarized with it, send that for you to review and develop any questions you might have. And I'll ship that to you through Regina or Al or however you'd like to get that. So with that, I'm just going to hand it over to Elise and let her take it from here. You can ask questions of them when they conclude. If you have questions for Paul or I at the end, we'll be here to answer those as well.
Thanks, Becky.
Thank you. Elise, you can take it away.
Elise.
Yes, thank you so much. I'm going to go ahead and share my screen here. Okay, and I will go ahead and move into presentation mode.
we might need to increase her volume a little bit. Can we do that?
It's all the way up.
Uh-oh.
On our end. It is.
Perhaps she can lean into the mic.
I'll certainly try to project.
Yeah, Elise, can you lean into your microphone a little bit more?
How is this?
That's good.
Good. Good. Excellent. Mr. Chair and members of the board, thank you so much for having us here today. We appreciate your time. I know you've had a lot of lively discussions today, so I hope this isn't too anticlimactic. I'll also introduce Todd M. Williams, my boss, our president and general counsel, who will be available to take questions after I run through this presentation. So this is our team. You're getting a half of us today. We put the lean and green. In addition to Todd and I, we also have an associate counsel, Aaron Pattison, and Christian Koch, our external affairs manager. So I'm just going to talk about why PACE, what it is, go through our process a little bit, sort of talk about where we've come as a company, and to offer you some sort of food for thought, some case studies from 2020, and then make Todd and I available for questions. So why PACE? So I know that Ottawa's been thinking through their sustainability goals recently, and we know that a lot of energy is wasted in buildings. Up to 30% is wasted. So by 2060, global building stock is going to double in area, and that amounts to a lot of energy. And so there's certainly a good reason to focus on efficiency measures as we think about energy transition. But the problem is that energy efficiency, water efficiency, and renewable energy projects can be very expensive. And traditional financing tools require maybe a 3 to 5 year payback for a long investment. So maybe you're going to see savings trickle in on your utility bills and operations and management costs over a period of many years, if not decades. So businesses often don't have an incentive to undertake these projects. So PACE was developed as an elegant solution to that. So it allows a property owner to enter into a voluntary special assessment to secure a private loan. And under Michigan statute, that loan can be repaid over a period of up to 25 years. So this program offers local governments a free economic development tool that can increase their tax base. The property owner gets a very favorable loan, and the PACE lender gets the security of the property lien that's created by the special assessment. So as others have mentioned, I think Al really went through it very nicely. Some characteristics of PACE financing is it's 100% upfront financing for the project, up to 25% of the value of the property at a fixed interest rate. It can be a very long-term loan, up to 25 years. It's a hallmark of a PACE loan. And it runs with the land, meaning it's non-recourse. And so if the property owner were to go out of business or to sell, that lien would move on to the next buyer. So Michigan statute lays out some requirements for projects that are greater than $250,000. For projects that are over that amount, there must be a savings guarantee, meaning that the amount the project is projected to save must be more than the cost of the annual assessment. And so the project must be cash flow positive from day one. For PACE Express, those are projects less than $250,000. You just have to show that there's an energy savings. The idea being that for these smaller projects, if you need a new boiler, you need a new boiler. But this could potentially help finance something that is more efficient than the property owner might otherwise be able to afford. So what can PACE finance? We would urge you to think pretty expansively about this, but I've just listed some of our bread and butter, things that we do on a regular basis. Can be lighting, HVAC, windows, insulation, all those sort of classic energy efficiency measures. Water efficiency can include stormwater recapture, low flow toilets, sinks, shower heads, and gray water systems. And then renewable projects, so solar energy, solar roofs, wind energy, electric vehicle charging stations are specifically carved out by Michigan statute as something that PACE can finance, geothermal, and combined heat and power. So very broadly, if an efficiency or renewable energy upgrade saves money, there's a good chance it may qualify for PACE. So the bottom line for those who are new to this program and are just learning about it, that the PACE was designed to make these improvements outweigh the costs. So for individual business owners who are considering making this investment, it is hopefully helpful to them in being able to finance the project. So I'm just going to run through how Lean and Green works to help coordinate PACE projects. So beginning at the beginning here, you see a list or a map of our current PACE jurisdictions. Ottawa County is not yet on there, but we do have some jurisdictions close to the west side of the state. So the Property Assessed Clean Energy Act of 2010 allowed local governments to opt into the program, which would enable them to allow special assessments on a case-by-case basis. So currently we serve 48 counties and townships and cities, and that comprises over 73% of Michiganders and an even greater proportion of the business-to-business market. So Lean and Green sits at the center of the lender, the contractors, the property owners, and we help qualify the projects and make sure that they're going to be a good fit for PACE. When it works, but it doesn't always. And so we work with property owners up front to see if they have something that's going to be a good fit. We conduct due diligence on behalf of the local governments to make sure that the project is compliant with Michigan statute. And we work with the lenders and contractors. So as you can see here, we sort of work with the local government and sort of sit at the center of a hub. So we work with the local government as they develop the special assessment, which creates the security interest for the loan. Property owners under Michigan statute can be commercial, hotels, hospitals, restaurants, office buildings, multifamily, both market rate and low income, but not residential, so 4 units or more. Nonprofit can include houses of worship, private schools or cooperatives, and industrial projects. So the contractor is there to design the project, they provide an energy audit, and they guarantee the savings to investment ratio greater than 1 for those projects that are greater than $250,000. And then the lender underwrites the project and provides financial capital. It is a competitive lending market. We encourage property owners to look around. Currently, there are 8 lenders who have financed closed deals in Michigan, and more are expressing interest in it every quarter. So we have grown quite a bit as a company since we first started out as Levin Energy Partners back in 2015. So we have financed 40 projects, and I want to say 16 of those have been in the last 12 months. So we've really taken off almost exponentially in the past year. And those 40 projects represent $82.9 million in private investment. And you can see in the chart how much that amounts to in electricity savings, carbon emissions, water savings, and money in the economy and jobs created. So this is a current map just sort of showing our trajectory over the years. Already in 2021, we've closed 5 projects. And I believe that's about, $9 million in private investment. So I'm just going to run through some case studies that show kind of the scope of what PACE financing can accomplish. So this is a really small project that we got really excited about last year. It's in the Poletown East neighborhood of Detroit. Fairly ordinary conservation measures, building envelope, HVAC. There was some energy efficient refrigeration and a solar roof. And that was going to help this building, which had been an abandoned church, be much more efficient than the property owner might otherwise have been able to afford using traditional financing. So it's going to be an apartment upstairs and a grocer and a coffee shop downstairs. And that grocery store is going to carry produce from an urban farm down the street. So this was a PACE Express deal. And so we didn't have to guarantee that the savings were going to be greater than the cost of the project. So again, a small loan, but a pretty big impact, $115,000 financed over 20 years in Wayne County. And again, this is going to bolster neighborhood development. So this is an example of how PACE can be used in new construction. Another deal last year was the Cambria Hotel in Shelby Township in Macomb County. And again, you see that, where you have a hotel or maybe a senior living facility, it makes sense to invest in energy and water conservation measures because those can add up to a lot of money over time. So there was a building envelope HVAC, lighting and electrical improvements, and plumbing and domestic hot water. This is a much larger project, $3.6 million financed over a 24-year term. And that's projected to amount to $7 million in savings over the next 24 years. This was a very interesting project and that it was a refi. So they used PACE to refinance some energy conservation measures that they'd implemented a few years before. As you can see, nothing extraordinary, just sort of our bread and butter, high efficiency HVAC, LED lighting, building insulation. And they thought that, maybe PACE wasn't a great fit for them at the time, that they could finance it themselves. But what happened is that when the pandemic hit, they were low on cash, and they used PACE in order to give themselves a little bit of operating capital so they wouldn't have to shut their doors. As you can see, $1.8 million over 25 years. And I believe they delayed the start of that repayment for a couple of years so it would give them some time to exit from COVID and open their doors and start doing shows again. So the exchange in Greektown, Detroit was our biggest deal yet. That may change soon, but very proud of this one. It was a very big deal on a new construction project, and almost just lots of savings. Low flow of toilets, HVAC, windows, smart thermostats, and roofing. $13 million financed over 25 years. And that is going to amount to a savings of $26 million over the next 25 years of the useful life of those conservation measures. So again, for those of you who are just sort of encountering PACE, we have done 40 deals in the past few years. So we have lots of conversations with folks and we work to try and qualify the right deals and help move local governments and property owners through the process. And so if you think that you have something that's on your radar, a property owner that may be interested in doing a retrofit, or somebody who's developing a new property, please give us a call. And with that, I will open it up for questions.
Thanks. Any questions? I see the wheels just turning in Al and Randy and Greg and Kyle. It's just thinking, how could I make this work in my situation? So any of you guys have questions? No.
I do.
Oh, okay.
Yes. How do you guys get paid?
That is a really fantastic question, and one that I would, it's a very natural one that comes up, and we're always happy to answer it. We are paid by the property owners in fees, and I think there's a residual during the life of the loan, but we work for you. We work on behalf of the local jurisdiction.
Hello, this is Todd Williams. The only thing I would add to that is we only get paid if a project actually closes. We will work for a very long time on a project and have them not close for any number of reasons, and that's just part of how we operate. We are really here to help property owners get through PACE and determine if it's going to be a good fit. Also, to coordinate with the county and make sure it'll be a good fit for them. I can tell you our fastest project we've ever heard about and got to closing was 5 weeks. Our longest one is Treetops Resort, which just closed this past year, and I believe we worked on off and on again for about 4 years. So we only get paid upon closing.
It's just like a realtor.
Yep. Yes.
Any other questions? You want to close
Yeah,
that?
if I could just close with just a
Sure,
comment,
yeah.
just real
Yep.
quick. Elise and Todd have a ton of experience, way more than I have on PACE, but I just do want to stress to you that we're looking at whether or not, as a board and as a county, we want to open up this opportunity to our landowners and establishing a PACE program at no cost to the county so that developers could come up and utilize it. We certainly, I would think, want to strongly entertain utilizing Lean and Green to implement that. We can do it ourselves. The thought of developing all of those items and products when they already exist through Lean and Green isn't real appealing, but that's kind of a second component. This is, do we want to entertain passing the resolution to establish a program so that if folks have a project, they can come to us and we can approve a contract and work with the local township and get them some help at this time where climate change is really important, water conservation is really important, and kind of open the door for folks to use this. So that's the primary component.
I support the program. I think it could be a win-win. But would someone on staff at the county be working on this project too?
Yes, there would be an authorized representative, I think is a term that they use in what is called the program report. A program report is a piece that would pass with the resolution that lays out all of the details, what the agreements look like, what the eligibility is, everything's in there. And within there, authorized representative would be designated. But it's really not a lot of work if you're working with Lean and Green. They really have kind of everything turnkey for us. So there'd be signing of contracts and communications, working things to the board, getting the contract in front of finance administration when we have a project come up, things like that. But there isn't a tremendous amount of staff time that would need to be involved if we utilized.
You're talking like 0.2 amount of time for an employee?
Well, it's probably generous. And here's the other thing to entertain. This is an opportunity, just like, for example, we have a Brownfield authority at the county level. We have 5 Brownfield amendment TIF plans since we've been inception. We don't get a lot of them, but we have them. It's available. It's a great economic development tool. This is similar. Elise had mentioned that there are 48 local units that have PACE programs. I think, and you guys can throw darts at me, Elise and Todd, if you need to, but somewhere in there is like only half of those local units have had any projects at all. Most of those have had one project, and a handful of them have had multiple projects. So there's not going to be a tremendous amount of time involved in this. It's kind of like almost like bonds, Al, to a degree, maybe a few more, but project comes up, you go all in, get it sorted out, push it through, and everybody wins. So
I think that's a good comparison because Karen and I typically meet with the rating agency, so it's about an hour. There's some prep for that, but this is more like a contract in the contracting process than it is a staff research and development kind of project. So I would say 0.2 would be high.
Oh, okay, very good.
Yeah.
So we need to pass a resolution as a board for like a contractor or a developer to use PACE.
Yeah, so in a real nutshell version, what would happen from here on out, should you guys all find this to be an appealing concept, is we would go to planning and policy to pass an intent to establish a program. And then we would have another meeting where we'd have the public hearing and then pass a resolution to establish the program. Okay, then we're all boots on the ground, we're ready to take projects. Then the gentleman, say from Holland Township, who would like to utilize it, would come to us. We'd work with Lean and Green to develop his contract. And then the next time that the commissioners, you all would see it, is when it came to you in the form of a contract. We'd communicate with the local unit as we develop that contract, so they're aware. We'd make sure that they were in favor of the project that was before us. So once you establish a program, the time you'd see it again is when it comes to in the form of a contract approval.
It's a lot easier because I did see that local units, so in Ottawa County, we blanket all by us approving it. It blanket covers Grand Haven. So because Holland's interested right now, they could do it themselves, but by us doing it, we cover.
We actually would, a county level approval is needed to even have the program in the county, but the county doesn't do special assessments. That's what townships and cities do. So they would still need to assess.
Yeah, the mechanics of that, and I actually was messaging Mike yesterday, the mechanics of creating the assessment, I'm not as well versed on, and Todd probably knows and is itching to explain it to us. But in answer to your question, doing a program at the county level is much more advantageous because then every local unit could use it. Could Howland Township still do its own PACE program? They probably could. I would see no benefit in that whatsoever, but yes.
If I can intervene, just for a point of clarity, the county most certainly can issue their own assessment, and the counties that have joined us in the past do just that. On a case-by-case basis, in order when they approve a project, it is the county's taxing authority and ability to create a special assessment. So you would not have to go through to the local level in addition to the county for approving of the project. That being said, nothing about PACE, it is a funding mechanism. It is not going to deviate one iota from the property owners need to go through permitting and planning and getting the project approved in that manner as well. And so this really is just about financing of the project. There will still be plenty of governmental oversight and input as to the actual construction of the project and whether it's a good fit. So never feel like we're cutting out by automatically approving a project at county level, the management and oversight of permitting and planning on the local level. The one other benefit of going at a county level is we do run into property owners with properties that skirt borders. And so we have a potential project right now that actually is in 2 counties. The fence line of the organization, or the building itself, is in 2 counties. And so with that one, we're going to have to go through 2 separate PACE programs, PACE jurisdictions. But if you have a project where the property is half in Holland City or Holland Charter Township and half in the city of Holland, having the county level program would prevent us from having to go through 2 approvals. We could approve it at the higher level then.
Thank you.
Quick question. Does this program affect in any way if a property is going for LEED certification? Can they do both? Can they qualify on the PACE side, and can they still do LEED cert? I mean, getting benefits on across the board that way?
My guess would be yes, but I have no good answer to that. Todd or Elise, do you want to speak to that one?
It certainly, we love LEED projects. Pretty much anything you're thinking of financing for LEED or putting into a building for LEED is going to be an energy conservation measure that can be financed with PACE. So we love LEED.
Thank you.
Anyone else? Yes.
Maybe this is for either you, Becky, or Todd, but local jurisdictions have planning commissions. What is the necessary requirement or the process that perhaps a local township planning commission would have to approve this relationship or this property?
I'll let Todd take that. I've read through the docs, but he's, I'm sure, a welder.
Sure, and again, this is really just kind of a financing of a project. And so, local planning for any construction project is going to be involved, particularly on any new construction project, is still going to be involved, but that'll be a slightly separate process from just the PACE process. This is kind of secondary. I can tell you we are not going to recommend to the county that you fund a project that is not going to be able to get permits. In fact, we would like to know that the construction is already underway or will soon be underway on new construction. It is a drop dead requirement that they've got their permitting in place. And so if it is not approved on that front end with planning and with permitting, we are never going to make a recommendation to assess the property and allow the funding to come in.
I have a quick question. Describe the process that would ensue if somebody stopped paying their assessment after 8 years on a 25-year assessment. Who would enforce that? Who's on the hook for the money?
Happy to address that. One of my favorite questions. This is the carrot that brings PACE lenders to the table. This is why we get them to bring large piles of money and make investments in our Michigan properties. It is a special tax assessment, and it is treated just like any other special assessment created against a property. The property owner fails to make a payment, the PACE lender will need to make notice to the county. The county would go through and treat it like any other delinquent special assessment and go into the collection process. We do build in to the special assessment agreement that LAGM includes and models protections against the county ever having to come out of pocket, either to make payment up front. We never involve PACE into the revolving fund. Or, in the absolute worst case scenario, if the property does not sell at a foreclosure sale and the county ends up owing it, that the county would ever have to come out of pocket for it. The ultimate risk falls on the lender. Any delinquent tax will get paid through the foreclosure process. Any remaining future assessments would run with the land to the new property owner. So it is always going to be the property owner or the lender who's going to be on the hook for the money.
And Todd, you've not experienced many instances of that with the 40 projects that you've done, correct?
We have absolutely none. No foreclosures in Michigan. We had a couple of properties this past year that went into a payment plan with their lender. due to COVID. Nationwide, there have been a little over 1,900 commercial PACE projects. I've just heard of my second one that has gone into a foreclosure process. So 2 out of
2. Okay.
100. Yeah. So the PACE lenders are just about as conservative as a bank. They don't like lending money where they feel they're ever going to have to collect on it.
Any other questions? Thank you, Elise. Todd?
Great. Thank you.
Thank you.
Thank you.
With that, report of a county administrator. Al?
Yeah, just a few quick items today. The Groundwater Board and the Groundwater Technical Committee have each had their first meetings now, and I think both were productive meetings, so they're off and running. Also, I wanted to mention that I did attend with several of you the Farm Bureau breakfast recently, and it was a good event. So we had some good reports out from legislators, some good questions were asked, so it was good to be among people again on a farm, breathing the fresh air and all that. So also just want to mention, just, interesting thing about the equalization report. That's a huge thing. And it's done so well by Michael and his staff that it's just kind of the white noise of Ottawa County. But it's an extraordinarily technical and difficult document to prepare. And if it weren't done on time, if the Ottawa County Board did not approve that document before May, not a single taxing jurisdiction in the county would be authorized to levy taxes unless they went to the state legislature and got a special, you'd have to have a bill passed and signed by the governor and all that. So it's extraordinarily important, and it kind of goes by quickly, but I just wanted to take a moment and recognize Michael and his team, just for the outstanding professionalism and work that they do there. And also likewise, when I look at the work that Karen's team did on the audit this year, when she said that, when Peter said that only 2 jurisdictions that their firm works with prepare their own papers, what that means is Ottawa County is saving a lot of money by not having to hire an audit firm to prepare our papers. So again, that denotes a high level of professionalism and capability within our fiscal services department to be able to do that. And again, I think this was an extraordinarily tough year. We got a lot of extra money in a huge amount of different pots, but what that means is the audits have more difficult as well. And so, and with working through the work from home and all that sort of thing, I think Karen and her staff did a phenomenal job with that. The other thing that's really important about the audit process, it's literally one of the underpinnings of the credit rating process. And so, qualified, having the clean audit report that we get every year, and the fact that that's relied heavily upon by the rating analysts that assign us our credit ratings. It's just, again, a very, very important process. Plus, this is the process where you, as the elected board, provide an accountability function between the citizens that elect you and the staff that you appoint to make sure that everything is going right with the money. And that's one thing Ottawa County is well known for, far before I started with the county. And I like to think that the commission and administration since that time has upheld and even improved upon that standard some. But certainly, I do appreciate all the efforts to that regard as well. Let's see, I think. And we anxiously await the instructions on the ARA money. And once we do, we're putting together a process and make sure that the board sees that and comments on that, and that we do this in a very business-like manner. I did like the quote from Senator Victory
Yes.
that the money, that we should consider using the money for meat and potatoes and not cotton candy. So I mean, it's just, and it's kind of the Ottawa way when you think about it, that we are conservative with money and we do think of the future. And so I think the money, some sort of bracketing system will come up and relief will be given where relief is needed, but also some money will be targeted to the future. And hopefully we can, accomplish some long-term goals that maybe right now are a little bit out of reach. So, and that is all I have for today.
General information, comments, and meetings attended. Anyone?
Mr. Chair, Yes, if I may, and I see everybody has a pen in their hand and paper in front of them. I got to save the date for you coming up. I'll save the date of May 10th through the 15th. It's a week where we set aside and we honor our law enforcement people across the nation, and especially those here that serve at Ottawa County. A chance where we can come together and look for opportunities to thank our deputies, especially those that are on the road today. I think today more than ever, they need a pat on the back, a word of encouragement, a handshake, a cup of coffee. And that's coming up with again, the week of May 10th to the 15th is Police Week. Look for opportunities if you can. We should be doing it always as leaders, looking for opportunities to thank the men and women that are serving the County of Ottawa. But especially this week, we set aside that particular week. So I encourage you to search out a deputy, shake their hand, thank them, maybe let them know that we're praying for them, buy them a cup of coffee, buy lunch, and maybe Sheriff Kempker between now and then will maybe even challenge us and other things that we can do for the men and women who serve us here at Ottawa County.
Well,
Wait a minute.
All right, we'll get you home by
Wait
3:30.
a minute, that comes under public comment.
Commissioner Dion, thank you very much. Just to say a couple words to that, there's also a second week, which starts May 2 coming up, which is National Corrections Week. A lot of people forget about the correction deputies that work in the jail facility. That is a profession also, along with our road patrol staff. And again, these are two special weeks to us in law enforcement. As Commissioner DeYoung said, it's been a tough year, and it's not getting any easier. And as you walk out of here today, there's a memorial in front of this building with 4 names on it. And as a sheriff and as any law enforcement administrator, we do not want to add any names to that memorial. And I can tell you that within the last 2 weeks, 2 deputies' names could have easily been added to that memorial in armed confrontations here in Ottawa County. And due to the professionalism of those 2 deputies, the ability to de-escalate a situation where they were faced with the firearms pointed at them, ready to go, the restraint that they used, the training that they used, we diverted and are very fortunate that we did not have a deadly force encounter. Mr. Al was with us this morning on a briefing with a board meeting with Hvac. The job's not getting any easier, folks. I'm going to tell you that. We are coming across more and more weapons, and it's getting worrisome. I can tell you a couple of weeks ago, just before I went on vacation, that 2 o'clock phone call in the morning. For any of us in the administration and anybody in our agency, when that phone rings in the bedroom at 2 o'clock in the morning, your heart hits your chest. And then to hear on the other end that, we had shots fired at Grand Valley with 4 subjects shot. Didn't hear about that in this county 10 years ago. So things are changing. But again, we have a professional staff that is out there every day providing good quality professional law enforcement services to the people of this community. And I know not everybody likes to see law enforcement, but I'll tell you, I've got the best team. I've got the best sheriff's office in this state. And yeah, it gets emotional, but thank you.
Thanks. Anyone else?
No, I just have to agree with Sheriff Kempker on what we heard this morning on Hvac, the board. So many more guns have been recovered. Some of them have 2 or 3 in the car with them. So he's right. I wouldn't want to be a police officer after going up to a car in the dark, rainy night. So thank you.
Yeah. I just have a couple of comments. First of all, I know it's awkward for us to say, I vote yes, but when you do that, remember your audience. Remember the audience that's listening on, is it YouTube or Facebook? YouTube. Remember the audience. I mean, if you just say yes, they may or may not have heard that yes. So that's why you need to say more than just yes. Okay, that's important. And also for people that speak, I didn't say anything to you, Al, just a few minutes ago when you were talking, but you weren't talking into the microphone. You were talking that way. And so, you know, I can hear when it's coming across the the speaker system, and it wasn't. So just as a reminder for all of us that we have an audience that we are inviting in to our meeting, and it's important for us to speak to them as well. On Saturday, I was invited to represent the county along with Robin at the Unity Gathering that was in Holland at Collins Park. It was interesting listening to the stories of Asian Americans talking about some of the things that they've gone through. And I think sometimes we forget that this is happening in the county. And I would just, again, challenge you all to read that book that I've encouraged you all to read, because it gives you a different perspective. And I know that we won't necessarily agree with all of the information that's in that book, but it's important for you to read it and think differently than perhaps you have in the past. I'm learning to do that, and I hope that each and every one of you also learns to listen and to learn what it's like to be in other people's shoes. So with that, I'm going to ask if there's any public comment.
I don't believe so. Sorry, Mr. Chair, there is no public comment.
No? I'll entertain a motion to adjourn.
So moved.
All in favor, say aye.
Aye.
Oh, same thing. Gentlemen, ladies, gentlemen,